So EGFR TKIs, and TKI here stands for tyrosine kinase inhibitors, and it just describes how certain medications work. And it's really changed how we treat these cancers. And on your right, you'll see that I've listed 5 currently approved EGFR TKIs for the treatment of metastatic EGFR non-small cell lung cancer in the United States. So as you remember, I mentioned that the EGFR mutation in this instance acts as an on switch. What happens with these drugs is that they come here and they block that EGFR mutation. And so whether or not you have a signal, it does not matter. That signal to continue to grow is turned off. And that's how these drugs can help us treat these cancers by turning off their signal and therefore resulting in cancer cell death. One question I most commonly encounter is, well, doctor, you told me you have 5 different drugs that are approved. How do you know which one is the best one? I will say that at least in the United States, the standard of care is really with a drug called osimertinib, and its trade name is Tagrisso. And it's really become the standard of care, in my opinion, for metastatic EGFR non-small cell lung cancer based on this clinical trial. This is called the FLORA study. The blue line shows how patients did with osimertinib. The red line shows patients who received other EGFR TKIs. And you can see here that the blue line is doing better than the red line. And in this situation, we saw that the use of osimertinib led to a longer overall survival compared to the other EGFR TKIs. We think the reason that osimertinib works better is that it's more specific to that EGFR mutation. So it doesn't affect the normal EGFR as much, so it's more tolerated. Osimertinib also seems to do a better job at getting to cancer that may try to go to the brain, because we know that unfortunately lung cancer is one of those cancers that do like to go to the brain, but osimertinib can help penetrate the blood-brain barrier and help treat cancer that may go to the brain. When we talk about drugs, though, of course, we know that there are side effects to really any drugs that we give. And the side effects of EGFR TKIs are pretty simple to understand once you've realized when I mentioned that EGFR can be normal, and it's in fact found in parts of your body, such as the skin and the gut, and in different parts of lining. So we think about the side effects, the skin side effects, we think about an acne-like rash, we can see nail changes, we can see some skin peeling or dry skin. In the gut, we can see mouth sores develop sometimes. We can see that patients can experience diarrhea. These drugs can cause fatigue or feeling like no energy. And then on blood tests, we can see that these drugs can cause elevated liver enzymes, a decrease in platelet count, and decrease in kidney function. So what can we do? We know that these drugs work really well, but we also want to make sure that these drugs are tolerated, because one of the most important things we want to do is make sure that patients have a great quality of life, and that's our goal. So when I talk to patients, some of the things I recommend are, for the skin change, we talk a lot about moisturization. We talk about using antibiotic creams or even oral antibiotics, especially for that acne-like rash. For the mouth sores and diarrhea, we talk about salt and soda mouth rinses and anti-diarrhea medications. I think some of the most common side effects of any anti-cancer treatment are fatigue and loss of energy. And in this situation, we can actually talk about decreasing the dose of the osimertinib. And we see that we can safely decrease the dose of this drug without significantly impacting its efficacy, which is a very positive thing that we can do. And for these elevated or change in blood function and blood tests, what we typically do is we get frequent monitoring. So for me, I always check a patient's blood counts, kidney function, liver function, and we can adjust the dose as needed to help make sure that these tests stay relatively normal.